Hello, my name is Tori Nakua. I'm a nurse practitioner student, and today I'll be performing a musculoskeletal and reflex examination on my patient. First, I'm going to do hand hygiene and introduce myself to the patient. Hi, I'm Tori. Can you please tell me your name and date of birth?
Jay Nakua, March 4th, 1991.
And how old are you?
I'm 34 years old.
All right, and can you tell me your ethnicity?
I'm Asian.
And where are you currently?
I'm at home.
And do you know today's date?
Today's date is December 11, 2025.
Excellent, thank you. So this is Jay. He is a 34-year-old healthy male with an Asian background. His appearance is well kept, well groomed. He is appropriately dressed for the occasion. He has clear speech and able to answer all questions appropriately. He is in an upright position. He's relaxed and does not appear to be in any distress. His skin color is appropriate for his ethnicity. He does have some burns on his right arm, and tattoos are visible as well. We will continue with our examination. We are going to start with the shoulders and work our way down. If you could please stand up. I'm going to turn away from you. Thank you. I'm going to talk about the different muscles in the shoulder and rotator cuff. So over here you have the supraspinatus, inferior spinatus, tres minor, and subcapularis. Okay. We're going to do two tests to assess the range of motion of his shoulders. The first one is the Ackley scratch test. I'll demonstrate first for you. You're going to reach one arm back, like scratching, and your other arm trying to touch. And then you turn away from the camera. He has fluid movement, easily to move. He does have decreased range of motion just due to like the increased muscle mass. Try the other side. Smooth muscle movement as well on that side. And turn towards the camera, please. Next, we will be assessing the drop arm test. So you're going to put your arms straight in the air, like so, and slowly bring them down. He has controlled smooth movements of bilateral arms. This is a negative drop arm test. We'll be moving to the wrist. There's two tests for the wrist as well. The first one is the Fallon's test, which is like a reverse prayer. This one is testing the first three fingers and half of the index finger for any numbness or tingling. Do this. Okay, we'll hold this position for 1 minute. After the 1 minute, do you have any numbness or tingling?
No.
Okay, so that will be a negative Fallon's test. We'll do another test as well. You can relax. For also tracking for carpal tunnel. So you're gonna let me know if you have any numbness or tingling in the first three fingers again, okay? This is the Tinsel's test. Okay. Numbness, pain?
No.
Okay. Tingling?
Nope.
Okay, so it's a negative Tinsel's test bilateral. We'll be moving on to the spine. You can turn around for this one, please. First, we'll do my assessment. He is upright. His shoulders are symmetrical. His right hip is a little higher than his left hip from a previous car accident. His back looks symmetrical as well. I don't see any deformities. I'm going to palpate the spine. I'm going to start at the cervical. Please just let me know if you have any pain or tenderness in the spine when I'm palpating. Any pain or tenderness?
None.
Okay, then we'll be checking the surrounding area, the paravertebral area. Same thing, just any pain or tenderness? Any pain or tenderness?
None.
Okay, none. And then we'll check the subiliac joint. Any pain or tenderness here?
No.
Okay. Next we'll be checking for scoliosis. If you can bend over, please. Okay, like I said earlier, his right hip is higher than his left. His shoulders are symmetrical. His scapulas are symmetrical. No weaning noted. Then I'm going to check his spine. No curvatures or deformities noted either. Okay, you can stand back up. We'll do one more spine test. This one you'll be laying down. Okay. I'm just. Okay. So this is the straight leg raise test. I'm gonna have you raise your leg with no bend in your knee, about 30 to 60 degrees. You can do that now. Any pain?
No.
No? Yeah, I'm gonna lower the leg a little and dorsiflex the foot. Any pain with this?
No pain.
Okay, that's negative on the left side. We'll check the right. You can do the same thing. Raise the leg. Any pain?
No pain.
Okay. Lower dorsiflex. Any pain here?
No pain.
Okay, so that would be a bilateral negative straight leg raise. That completes the spine assessment. We're going to be moving down to the knees, checking for stability of the joints and ligaments in the knees. The first one we'll be doing is the valgus and varus test. Valgus is on the lateral side and varus is on the medial side. We're going to raise your leg up again. I'll hold it for you. I'm just going to push a little bit. I'm checking the stability of the knee. The knee is stable. There's no movement when I push. I'll check the medial side, the varus. Push a little. No movement of the knee, so those are intact. On the left side, we'll go over to the right leg. If you could raise that up for me. The valgus on the right side. No movement of the knee. And varus. And that is intact as well. There was no movement of the knee. We'll check next the anterior and posterior cruciate ligament. For this one, you're gonna bend your knee up. Okay, just like so. Sit for stability. And I'm gonna pull a little bit and a push, okay? I do not see any movement of his tibia or fibia on the left side. Okay, put that one down. We'll check the right. No movement of the tibia or fibia on the right side either, which means no ACL or PCL tears in the knee. Next, we'll be checking for a meniscus tear using the McMurray test. We'll start with this one. You raise this leg up for me. Okay. We're gonna externally rotate the knee, internally rotate the heel, and I'm just gonna have you push out for me. Any pain or tenderness with that?
No.
Okay. I do not feel any popping, clicking, or crepitus in his knee as either. Okay, you can roll. And then we're gonna check the varus. So internally rotate, the knee and externally rotate the heel. Push out for me. Any pain with this motion?
No pain.
And I don't feel any popping, clicking, or crepitus either. We'll check the left leg. Raise up. Okay, externally rotate. All right, and push. Any pain?
No pain.
No popping, clicking, or crepitus noted. We'll internally rotate the knee and then push out. Any pain?
No pain.
Okay. No popping, clicking, or crepitus noted of the left knee either. which is a negative McMurray test. No meniscus tear noted. That completes that portion, and we're going to be doing deep tendon reflexes. So if you could sit down for me. Thank you. We'll start with the bicep reflex. But first I would tell you about the grading of the reflexes. Deep tendon reflexes are graded on a scale from 0 to 4. 0 is there's no reflex, no response. 1 is a diminished response. 2 is an expected. 3 is a brisk response, and 4 is a hyperreactive response. Okay, so we're gonna go to the bicep. I'm gonna try to find his bicep ligament first. Here's like a 1+ response. Do the left side. Oh, and this is also testing C5 and C6. 1+ response on his left side as well. Next, we'll move over to the tricep reflex. This tests C6 and C7. So I'm gonna find his ligament first. Just relax. Okay, 1+ response on the left side. Okay. A 1+ response on his right side for the triceps. Next, we're going to check the brachioradialis reflex. Just relax your wrist right here. 2+ on the right side. This also assesses C5 and C6. That's pretty good. 2+ on the left side as well. We're gonna move down to the knees. Let's move this. Thank you. Okay, just try to relax. The knees are assessing, we're checking L2, 3, and 4. Relax. That's good. 2+ on the left side. Like 1+ on the right. And the last tendon reflex we'll be checking is his Achilles tendon. This assesses S1. Okay, so dorsiflex. No, 1+. 1+ on the left as well. Okay, thank you for your participation. That completes our examination, and I'll move on to my portion. Hello, Tori again. I'm going to be completing the rest of my assessment on myself. First, we're going to talk about the range of motion, joints, and what we're looking for. First, you'll be inspecting the area, looking for symmetry, any deviations, misalignments, or deformities. You'll look at the surrounding tissues for any redness, bruising, swelling of the area, muscle atrophy. Next, with palpation, You'll be seeing if there's any tenderness or pain to the site, any swelling, bogginess, any warmth to the touch, any if there's popping, clicking, or crepitus upon palpation. Next, you'll be assessing the strength. We do this on a grade from 0 to 5. 5 is the expected 5 out of 5. And 5 is active movement against full resistance. 4 is active movement against gravity and some resistance. 3 is active movement against gravity. 2 is active movement against the body with gravity, without gravity. And then 2 is only a trace of muscle contraction, and 0 is no muscle contraction whatsoever. Next, we're going to be moving on to range of motion. I'll demonstrate the different ones. We'll start with the fingers. Extension, flexion, abduction, adduction. We have the wrist, flexion, extension, radial deviation, ulnar deviation. Your elbows, flexion, extension, supination, pronation, supination, pronation. Shoulders, extension, flexion. You have abduction, adduction, external rotation, internal rotation. Neck is flexion, extension, right rotation, left rotation, right lateral bend, left lateral bend. We'll go to the spine. You'll have extension, flexion, right lateral bend, left lateral bend, right rotation, left rotation. We have the hips, flexion, extension, abduction, adduction, external rotation, internal rotation, knee, flexion and extension, ankle, dorsiflex, plantar flex, eversion, inversion, eversion. That's flexion of the toes, extension of the toes. That will complete our range of motion.